our discerning and loyal listeners. Right, we're starting off with our festive season series. And today I've got one of my old friends, a good friend of the program, Kofi SL, Director, Industrial Support Services Directorate of the Food and Drugs Authority. Yeah, today we're taking a look at food safety. It's an everyday issue. But of course, we want to hit on it and emphasize it during the festive period. Some say from farm to fork, planter to plate. But the processing, handling, storage of food and food products is a very, very significant health issue. If you have any questions, concerns, share with me. WhatsApp is 055 11 11 997. We're live on Facebook and YouTube. Ultimate Health on Joy 99.7 FM. Uncle Kofi.
Yeah,
good afternoon.
Good afternoon. It's been ages.
It's been a while.
You're refusing to grow.
I'm refusing to grow. No. Charlie, you don't want me to report the aches and pains, huh? Sincere apologies for keeping you waiting, and I'm most grateful that you agreed to join us in the studio today.
Thank you very much.
Yeah, we haven't
it's
had
always
you,
a pleasure
yeah,
to
we haven't
be
had
here.
you here since a little after COVID.
Yes.
Yeah.
Yes.
Right?
Yeah.
You haven't been here for a while, so we'll baptize you small. So you're most welcome.
Thank you very much.
Yeah, for many people, when they hear food safety, many things come up in their mind. But I was introducing the topic, suggesting that the processing, the handling, and the storage of food could introduce many, many, many challenges that could be a threat to our health and well-being. So I'm grateful that we have you in the studio to go through with us, right? But yeah, for the benefit of our listeners, when we say food safety, what kind of things come under that umbrella?
Well, thank you very much. And let me take this opportunity to also say hello to your cherished listeners, those who have patronized this program for all these years. Yes, it's true, I've been off for some time, but I'm happy to be back.
Yeah.
And coming back, discussing this very topic, it's very dear to my heart because I speak food safety, I sleep food safety, I walk food safety.
Whoa.
It's been something that I enjoy doing, and that is what I'm trained to do.
Right.
To draw attention to it. And so my operations at the FDA, industrial support, basically, if you take the food component of it, the essence of Food and Drugs Authority's responsibility or mandate is to make sure that what people are consuming is safe.
Right.
All right. So food safety generally will refer to all the practices involved in handling of food, like you mentioned, from farm to fork, right from preparation of the soil, getting your planting material ready, if you are dealing with crops, up to the point where you harvest, up to the point where you transport, either you're processing it further,
right,
until the time that the food is consumed. There are so many players along the line, and there are so many activities that you will encounter in between. Now, everything that has to be done to ensure that the final product that is consumed will not impact negatively on the health of the consumer.
Right.
Okay, come into this enterprise we call, or come under this enterprise we call food safety management. Food safety.
Right.
So basically, food safety is a concept, all right, that ensures that food, when used as prescribed, will not impact any negative health.
It should nourish the body.
It should nourish the body.
Not harm the body.
Not harm the body.
Right.
Okay. Yes. So where we fail to observe any of the factors that will lead to introduction of what we call food safety hazards,
right,
it will lend itself to the food not becoming safe for consumption.
Right.
And like I mentioned, you have several individuals who play several roles.
Individuals, stakeholders.
Yes, including the consumer.
Right.
Because you can be served with a very good food.
Right.
All right? But you fail to read labeling information.
Okay.
The labeling information says that once opened, keep refrigerated and consume within 3 days.
Right.
If you fail to observe it, and remember I said when used as prescribed.
Okay.
Okay, so if you, the consumer, even fail to observe those instructions, you render the food becoming unsafe
Okay.
for consumption.
Right.
And so you, the consumer, also has a role to play.
So each of us has
Every one of us.
a stake in this whole process.
Sure.
This enterprise we call food safety management.
Sure.
Okay, right. Now, you are coming to us from the Food and Drugs Authority, now authority, right? And we
Yeah.
must respect your authority. But this is a very broad, wide spectrum of activities that may impact, in this case, negatively on the safety of the food, on the safety of the consumer, so on and so forth, right? I know you have stakeholders and partners. Does the FDA oversee or have jurisdiction over the full spectrum that we just described? Are you responsible for checking what's happening when it's with regard to planting, preparation, and all that? Or I know there's Ministry of Food and Agriculture and so on and so forth. So I'm just trying to for you to give us the domain, right, and then to zero in on the domain that you operate in as the FDA.
Well, thank you very much. I think this is the reason why nations world over, developed economies, middle-level economies and all that, trying to focus on specialization.
Right.
All right. So if you take the entire spectrum of food production,
Right.
whether fish farming or whether it is about animal husbandry, crop production, there are several players.
Right.
Okay. And one entity will not be able to do all that.
Okay.
If you even take Ghana, for example, I can mention on top of my head about 3-4 agencies. The Food and Drugs Authority, the Ministry of Local Government and Rural Development,
Okay.
Ministry of Food and Agriculture, Ghana Standards Authority,
Right.
okay, all have roles to play, different roles to play.
Okay.
Veterinary Services
Right.
Directorate,
Directorate.
PPRS, the Plant Protection Regulatory Services.
Okay.
Every one of us have certain role to play in this enterprise, and therefore it is for us to be able to identify which areas we have expertise
Okay.
and what we are supposed to do where. And that is the reason why, like I mentioned, that countries are specializing. And so you have what we call the food safety policy. Currently, we have the National Food Safety Policy. Now, the food safety policy defines the various entities or defines the entire food
Okay.
production spectrum,
Right.
right? And identifies all the stakeholders and what each
Each of
stakeholder
them
is supposed to do
under the policy.
under the policy.
Right.
So if you take primary production, let us take, say, crop production. There is somebody responsible for ensuring the safety of the planting material.
Right.
All right. And so you have entities under Ministry of Food and Agriculture,
Okay.
the Plant Protection Regulatory Services, through the extension services. They will ensure that the planting material that you're using are safe planting materials. The issues about agrochemicals use will come under them,
Okay.
because you remember that if you abuse agrochemicals, they will end up in your harvest, and eventually that product will end up on the tables of the consumer. All right. So who controls which agrochemicals come in?
Okay.
FDA certainly is not responsible for that.
Okay.
Okay. And then who applies agrochemicals? How should the agrochemicals be
Right.
applied?
So that's where we have
That is
all the
where
extension officers.
extension
and all that.
officers
Right.
helping the farmers
Okay.
to do all these things. All right. Now, when there is the product even harvested, okay, somebody transports the product onto the market.
Okay.
All right. Someone will have to make sure that the transporting entities or
Right.
the transporting bodies will ensure that the products are transported under the right conditions and all that.
Okay.
I will admit
So in this
that
instance, for example, if it's supposed to be at a certain temperature,
yes,
right?
I will admit that we have gray areas, and that these gray areas, I think government is doing its best to, as it were, woo the private sector to
Okay.
come in. For example, as we speak now, I was just talking to a friend who runs an abattoir. Okay. And another person who is also running a cold store. You have people come to buy, say, fish from a cold store in Tema and transport this fish all the way from the cold store in Tema to, say, Mankesim,
right,
or to Takrady or Cape Coast or what have you. And I realized the majority of them do not transport these frozen fish under any control temperature.
Okay.
And so by the time the fish gets to Mankesim or the fish gets to Cape Coast, it is stored and it has to be refrozen. Now, this freezing and thawing and refreezing and all that will affect the quality of the fish,
right,
because the cold chain management has broken down.
Has been compromised.
Okay, so there's a gray area here. Can someone take up this responsibility? Come in with vans, okay, that are cold vans.
Right.
Take, for example, Fan Milk will not transport ice cream from the up plant here to any of the key distributors, okay, without ensuring that they are transported under this cold in a cold van.
Okay,
but we will not get the same thing when it comes to other food items, because it is virtually left in the hands of the private sector.
Right.
Okay, individuals to do that.
Even currently as we speak,
yes.
There are grey areas.
There are grey areas
in the management of some of the components of the food safety management chain.
Yes.
Right.
And that will have to ensure that that is done.
Okay.
The FDA will only raise the concern,
right,
because eventually, for example, if you take the issue of these cold vans, the FDA doesn't have that responsibility, or doesn't have that capacity to provide cold vans.
Right.
We can provide cold vans to cold storage facilities. What we can tell them is to make sure and then bring in regulatory framework,
right,
that will ensure that you cannot transfer from point A to point B,
okay,
without a cold van.
Right. Kofi, for the benefit of my listeners, let's emphasize or underscore and get you to emphasize this point. What you're saying is that for products that need to be maintained at a certain temperature, right, where they are not, and therefore there's some degree of thawing that takes place, right, and then they get to final destination, then they refreeze and so on and so forth. That in itself introduces the potential for the food safety standards to be compromised.
Sure.
Right.
It's true. Yeah.
Okay. And I know that even at home, when you heat and reheat food under certain conditions, you are also compromising the safety of the food. Okay.
Yeah, let's understand that no food is sterile.
Right.
No food is sterile. And that is why when you keep food in the fridge, it can even get moldy,
right,
in the fridge. All right? So, assuming that you have fish that is stored, once the fish stores, the microorganisms in the gut or the fish will start acting on the fish, and in the process, the fish will start deteriorating.
Okay.
Okay. If these microorganisms happen to be toxin formers, okay, they introduce the toxins in the food. And remember, some of these toxins can be thermostable.
Right.
So irrespective of the temperature that you cook the fish or you cook the food,
they survive.
They will survive.
And multiply.
Okay. And so once the toxins are formed in the fish, you refreeze it and then prepare it later on. The toxins are there. And then you eat the fish and you fall ill.
Right.
And that is why cold chain management is a key element when it comes to food safety management.
Right.
Once the food requires a certain temperature range for it to be transported, to be held, you do not have to compromise that.
Okay. Right, folks, if you just joined us, 29 minutes past the hour of 2, the program is Ultimate Health, your ultimate guide to healthy living. Listen every Sunday, 2:05, with me, Naughty by Nature. I'm in the company of Kofi Essel. He's the director at the FDA for Industrial Support Services Directorate. Am I right?
Sure.
Yep.
Yeah, that's it.
Yeah.
You got it.
Okay. Right, and we're looking at food safety as part of our festive season series. Food safety, what's your role? What's the role of the regulators, and so on and so forth? What should you be looking out for? Definitely, if I have goods and products during this, in quotes, cocoa season, I'll dump them on the market, and maybe the unsuspecting, untrained, uninformed consumer will purchase and consume these things. That's why we're having this discussion, so that we all get a sense of understanding and empowerment when it comes to the role we play individually and collectively in the food safety management ecosystem. Let me call it that. Yeah? Key things that Kofi has said. No food is sterile. So whatever we call food or food products is active in some way. Yeah. There are some organisms, there are things at play, right? Active. Okay. And we need to know how the food was prepared, grown, processed, transported, and indeed even packaged, right? Before it got to us. That's what we're discussing. And there's so many telltale things that we can share with you that you could look out for to protect your health during this season. If you have any questions, concerns, share with us. WhatsApp is 055 11 11 997. Our phone line is 030 221 6541. Apologies once again for the late start. I had a little bit of a, should I say, hiccup with my own transportation. It wasn't about the temperature. But we're on now. Facebook is active. I'm told there's a little hiccup also with our YouTube, so do bear with us. But shortly I will activate the phone lines. I've announced them already. 030-221-6541. Ultimate Health on Joy 99.7 FM. Oye Inafienya, great to be in your home as always. Right, so if you have any questions, concerns, experiences, share with us. The FDA is in the studio in the person of Kofi SL, right? If you have any questions about their role or even how to complain, should you pick up some of the things that we're going to be pointing out to you, he'll be sharing that with us. So, Kofi, let's come to your domain where you are in charge, your jurisdiction, right? So some of these things are outlier processes that we talked about. They may be upstream, some may be downstream. But specifically and emphatically, when it comes to the FDA, which areas are you in control of, and are you able to give us some tips and education and information on?
Well, when it comes to the area of food, we concentrate much more on the manufacturing and the processing of food, and where we find the need to collaborate with other agencies, we do same.
Right.
We are also looking at the area of food service, working very closely with the Ministry of Local Government to ensure the safety of street foods.
Wow.
Okay, yeah.
FDA?
Yes.
Okay.
And so we did a pilot work with Osu area. Osu area. I don't know. The district assembly, the name of the area.
Okay.
Where you will see
Koleklote,
good.
Right.
And you will see stickers that are put on vending points, food vendors.
Right.
Have these stickers, meaning that they have gone through some training.
You're talking about individual food sellers.
Food sellers, yes.
So like things like Wache,
Kinki sellers and all that.
You did a research or a study with them?
We did a training with them. Training for them. Basically hygiene, making them understand the principles of food safety, sanitation issues, hygiene practices. Because majority of Ghanaians eat one meal or more outside our homes. And therefore, food vendings or street foods have become very much part of our source of nutrients or nutrition and what have you. And therefore, if we fail to ensure the safety of street foods, we'll run into trouble.
So is it a process where you are building their capacity and
we're building their capacity?
Some way, should I say, giving them the thumbs up or some form of certification or recognition?
We're giving them training, educating the public to also look out for such stickers or license, so to speak, so that these are the people you can patronize food from. In other words, we're trying to tell you that if you want to buy safe food, these are the people that you go to.
Okay.
For instance, if you take the prepackaged foods, it is the FDA registration number they are looking for. What if you're not buying prepackaged food and you're buying?
So where would I see this sticker, for example, with a well-known Wache joint in Koleklote?
No, it is usually put on their vending table or what have you.
All right.
Whatever they
So
blend
we
their
should
food.
look out for an FDA sticker.
Stickers, yes.
Does it have any
It will have a
color?
It will have a registration number on
Right.
it. Okay, and you can actually verify
Right.
from the FDA whether these.
So you can
numbers,
ask your local neighborhood watch seller
whether he has FDA license or otherwise.
are they running foul of the law if they don't have this? Because you mentioned a specific area where you've done the training and enhanced their capacity.
You know,
Does it apply across board?
when you are when you're introducing a new system, it is quite challenging. It's a social program that you want to, a public health program you want to introduce. But these businesses have been there for so long a time, and we have seen some lapses in the regulation of their activities.
Right.
And therefore, you're very careful how you go about it. You need to get their buy-in. And once they accept the concept and they understand that we are doing this for you, it is for your own good, it is for your business to grow.
Okay.
Because once the public gets to know that you have been trained, you are food safety conscious, and therefore you can assure the safety of the food that the consumer is going to buy from you,
Right.
then people will patronize your products. If you take, for example, freelance caterers, and then especially during this Christmas period,
Right.
we advise agencies who wants to organize end of year parties and things like that. Don't just go out there and then request for the services of somebody that you know who knows how to cook very good food.
Right.
Food safety is not about the taste. Food safety is about the absence of
But Kofi,
hazards.
are you suggesting that some of these services and service providers should have some kind of recognition from the FDA?
Precisely, that's what I'm talking about. And so freelance caterers are also coming to the FDA. The banks are doing this very well. They are ensuring protecting their staff.
Well,
So you
registering-
cannot go to any bank today and then ask to provide them with lunch without first they asking you whether you have the FDA food safety license.
Interesting.
Yeah.
All right, if you just joined us, 37 minutes past the hour of 2 on Joy 99.7 FM. We're starting off, we've kicked off our festive season series. Today we're looking at food safety with Kofi Essel of the Food and Drugs Authority. He's the Director for Industrial Support Services, and I think, is it food standards as well? There's something attached to it.
No.
Or it's just directed.
Directorate.
Industrial,
Yes. Yeah.
Okay, support. Good afternoon, Norty. How are you? And Director, I thank you for the topic for the day, food safety. Please, my question is that why reheating of potatoes can be harmful to eat. Second, please, the time that you lost for us, we waiting, please. Add it back from Hayford in Bato. All right, Hayford. Unfortunately, I typically I'm able to haggle with Abeku for a little extra time. Today there's sports, there's football afterwards. But based on our relationship with our resource persons, we are able to bring them back. So we'll definitely continue this, right? So Hayford is asking, like, for example, reheating of potatoes, right? I've had it, didn't eat all of it, put it away, and I reheat it. And he's picking up from the point where we said this changes in temperature and all that could introduce or compromise the food safety.
Well, any food, any leftover food, which is poorly handled, presents some food safety risk.
Okay.
Okay, not only potatoes. All right. So the best thing to do is that if you have any leftover food, please keep it refrigerated, and then bring it to the boil. Bring it to the boil. It should be piping hot before you eat it again.
All right.
Okay. So any food at all can be dangerous if not properly reheated before eating.
Okay.
Okay. So when you have any excess food, please make sure you keep it frozen. There is a practice, and I don't know where they got this from. Most ladies will cook jollof rice, for example, jollof in particular, and that if you you can keep it at an ambient temperature in the kitchen, and there's nothing will go wrong with it. No, everything will go wrong with any food that is kept under ambient temperature.
Right. Room temperature.
Room temperature.
Right.
Remember, we have something we call the danger zone.
Right.
Any food that is kept within the danger zone. And the danger zone is any temperature between +5 and +65. So when you keep any food within this temperature range, and +5 is outside the fridge, and +60, above 65 is something that on fire.
Right.
All right. So room temperature is within this temperature range, +5 and then +60, 65. And so once you keep the food under this condition, under this temperature, remember I said no food is sterile.
Right.
And then the environment itself has all these microorganisms.
So what you're doing
and spores.
is reducing the chances, the potential for anything damaging to take place.
Yeah. So you either keep it refrigerated or you keep it on fire.
Right.
That is why we say that if you go for a party, for example, and salad which is not cooked is served, that salad should be served on ice.
Whoa.
And if you are going to eat white or anything that is cooked, they should have some level of heating under this food. And so this Christmas, I'm happy we started discussing this. And there'll be a lot of parties going on and all that. People go for parties during this time and they come home with food poisoning.
Right.
And it's all because they don't pay attention to these things.
Okay.
And then caterers themselves also fail to observe these food safety practices.
All right.
And that is why we've taken on caterers and giving them training and sensitizing them, especially the freelance caterers.
Okay. Great stuff. 41 minutes past the hour of 2 on Joy 99.7 FM. We're discussing food safety with the Food and Drugs Authority, represented here by Kofi SL. If you have any questions, concerns, experiences, testimonies, especially when it comes to food that didn't quite go down well, we need to talk about that. We'll do a separate program to look at the clinical presentation of food poisoning. What really is food poisoning? A lot of you put a lot of malicious tags to that, as if somebody intentionally set out to poison somebody. But if you look at the processes we are talking about and the food safety management chain, you start to understand that it's pretty easy. So
we may have a poisoned food,
right?
That is deliberate addition of something
Toxins,
to kill.
Yeah.
But food poisoning is an intrinsic process, something that is built up within the food.
Right.
Okay, that can lead to an illness.
Right. The same way in the hospitals we have infection control. Right.
Yeah.
We want to make sure that the environment in a hospital.
Yeah.
So,
but when somebody intentionally injects you with a virus to kill you, that is.
So we're not talking about malicious, intentional food, but we're talking about the actual, processes that may poison your food or make them toxic, right, to you. If you have any questions, concerns, phone line is 0302-216541. WhatsApp is 055-11-11-997. Good afternoon, Notedua. My name is Winfred. I have been trying to get in touch with you for some time, for some discussions. Please, can you send me a contact number I can reach you on? Please, it's very urgent. Joe, all right. Well, I can see your number up there. I'll try and make contact with you and find out what's burning. All right. Thanks for sharing. If you want to share something, ask a question, this is the time to do it. WhatsApp 055-11-11-997 and the phone line is active 030-221-6541. Ultimate Health on Joy 99.7 FM. Right. So we're understanding some of these things, and it's intriguing and fascinating because when we say we want to do the proper education, partnership, and building of capacity, for many of my listeners, it means nobody will be sanctioned or cautioned or fined when they have failed to adhere to what you announced to us is policy and practice, right? It means, well, we are trying to get you on board, right? So to my listeners and sometimes even to myself, it looks like, kids' gloves, okay? No. Somebody is sitting in Osu, Kole Klote, has been helped to build capacity, right? Somebody can be in the same constituency and refuses, but because FDA is building capacity, grandfather's rule, and this, that, they've been there for a long time. That's where, can you convince us of that? Let me just take this call and then you come back with that. Hello, good afternoon.
Yeah, good afternoon.
Yes, good afternoon. Who's speaking?
This is Nana Kwesi.
Nana Kwesi, where are you calling from?
I'm calling from Nungwa.
Nungwa, okay. Share with us, Nana Kwesi.
Quick one, I just want to find out, if food is hot, for how long do you have to wait for it to be cold before you put it in a freezer? Yeah.
Okay.
That's all what I want.
Right. He's saying if you have hot food, right, you've done what you want to do with what you want to eat. How long should you wait? And how cool should it be before you put it in the freezer or in the fridge?
Oh, okay. You may not have what do you call it? A thermometer.
Hello?
So to
Yes,
speak.
hello? Oh, there's another
Hello.
caller. Let me
Okay.
just quickly take this other caller. Hello, good afternoon.
Good afternoon, sir.
Yes, who am I speaking to?
James from Abudu Mercy.
All right.
Mr. Essel, I know, but I have a problem. Please, I beg, talk to Mr. here for me. If you get to settle now, the kind of alcohol that is popping up, without no FDA is very, very worrisome.
Circle, you said the
Okay.
kind of alcohol.
Yes, popping up around circle there, without no FDA is very, very worrisome.
Right. So this is alcoholic products for sale.
Yes, yes.
Okay.
I've been to his office before with one kind of something like that before.
Okay. Right. Thanks for sharing. Right. His concern is about alcoholic products that don't have any FDA stamp or number or recognition on them. And he says there's particular concern around Circle. He says he's been to your office before about this kind of thing. Yeah.
Oh.
So the first one was about food temperature and putting in the refrigerator.
Yes. Usually, when the food is cooked,
All right.
okay, it is advised that you don't put it bulk into the refrigerator.
Mm-hmm.
Okay, if you have to portion it out so that it cools very quickly. When you portion it out, you increase the surface area.
Okay.
So it cools down very quickly.
All right.
And that is when you can put it in the fridge. Remember, I said if it hits around, it shouldn't stay in the danger zone for more than an hour.
Okay.
All right. So if you can cool it to about 40 degrees, that's okay. You can put it in the fridge.
Right.
Okay. But would you be able to tell whether it is 40 degrees or not?
Right.
And so once you
So you
portion
don't
it
want
out
it to be at room temperature,
for more than
exposed
exposed to, I mean, keep
to
it in the
those
room
temperatures
temperatures
and other
for
things.
for more than an hour.
Right.
All right. And then 1 hour is too long a time for portion food to cool.
Right.
So most often when you portion out the food,
So break it down into smaller
within
portions.
30 minutes, it should come, the temperature should come down,
Okay.
and then you can put it in the fridge.
Right.
Okay.
Okay.
With the
Alcoholic products.
alcoholic beverages, and we will have to speak specifically about this probably at another time in the course
Okay.
of the Christmas period. Yeah, we understand that around this time there were a lot of purchases and all that. And remember, this is the time smugglers and then unscrupulous business persons will want to take advantage of the unsuspecting Ghanaian consumer.
Right.
And then they sell these things too. Okay.
Mhm.
I have had situations, we've investigated situations where high-ended products
Right.
were faked. And I'm talking about
The spirits.
the black labels and then the red labels and all
Right.
that. You know, Johnny Walkers,
Mhm.
you know, Jack Daniels and what
Mhm.
have you. And these were being faked. Okay?
Faked locally or
What it, you know, faked somewhere,
and then
faked somewhere.
brought in to
Yeah. And it was being sold in the bar.
9.7 FM.
Okay? But fortunately, this person realized that anytime he took that particular product in the bar, you know, a tot or so, he had this sensation and he knows the product very well.
right.
All right. So we went in, did the investigation, and then there are security features about those products too.
Okay.
All right. So the FDA knows those security, and we
Right.
have those security features.
So what should we look out for?
So be very careful where you buy these things.
Okay.
Certainly, the FDA will not be able to follow you wherever you go to.
Mhm.
But if you go to a place, and usually for such products, and this is economics, nobody selling any fake product will sell it at the same market price
Okay.
as the original product.
Right.
All fake products usually will sell cheaper than the original
They
ones.
undercut.
The undercut.
Right.
And so be very careful when the price of the product is very
So
low.
the price is a telltale indicator. Is there anything that should be on the packaging?
The packaging themselves, but you may not be very good telling from the packaging. Okay, I remember we had extensive training for our staff who were doing post-market surveillance, and over time, people stopped
99.7 FM.
that particular activity. There's this particular schnapp, J.H. Henkins
Right,
schnapps.
right.
You know, it's been an old schnapps,
Yeah.
Jack Bulls from Holland for so long a time. You know, we started faking it. and virtually everywhere you went to the extent it got to a time I was even joking with it, that we've been pouring fake libation
To the gods.
So the gods are angry with us.
Wow.
Yeah, and we have been contracting marriages with fake, and that is why we're having a lot of divorces and all that.
So it would take a trained official of
It
FDA
take a trained official to detect it. Even
If I'm
as
suspicious,
if you're
Kofi,
suspicious,
what should I do?
no, bring it to the attention of the FDA. Don't hesitate to let the FDA know that this is what is going
Is there a
on.
number I should call? Is there a web page?
Oh, certainly. We have numbers that I'll let you have those numbers.
Okay.
Before we end the program.
Okay.
So that
right.
you can.
We're about wrapping up because the
Yeah.
sports guys will be breathing down my neck. Good afternoon, Note. Please, is eating this leftover business? Leftover fufu good? If no, how could one preserve fufu? Remember, I have no fridge. Igwe from Ahafo, Kukum. Igwe, how do I know you have no fridge? But okay, right.
Traditionally, we have the Krobos. They have something to call fufu kusa, right?
Fufu?
Kusa. Is
Kusa.
that yeah?
Right.
Where you have this leftover fufu,
Mhm.
and then in the following day you put it in the pot with soup, and then you boil it over and all that. There may be traditional practices,
Joy,
and
99.7 FM.
some foods in themselves, ferment,
Right.
and in the course of fermentation, certain acids or the pH of the food drops. All right, and becomes acidic, and therefore some microorganisms are unable to attack such foods.
Right.
All right, and so they may be safe, but it's not the same with all foods.
Right.
If you take rice, for example, the best thing for you to do is that keep it refrigerated. If you don't have the fridge, then prepare a portion that you can only eat at a time.
Right.
And then for the benefit of your health, please don't joke with some of these things.
Okay.
And then leave food at room temperature and think that it will be safe for you to eat.
Okay.
All right.
Right. Somebody else wants my number and says it is urgent. Kofi, you need to put me under refrigeration. There's a lot of active ambient stuff going on, but I'll see what it's about. Mr. Alfred noted, this must be somebody DC, Douglas from DC. What is the main cause of food going bad still, even in the in the fridge? And I like taking hot food. Normal temperature. I was told it's not good. I can't eat cold or cool food too. At temperature is good. So what temperature is good for our intake? Douglas from DC.
We usually say that cooked food should be eaten hot, uncooked food should be eaten cold.
Okay.
All right. When we say uncooked food should be eaten cold, for example, vegetable salads, for example, keep it on ice,
Right.
all right, in the fridge, because remember I said the microorganisms are there. It is the temperature that will make them active and then for them to proliferate.
Okay.
And therefore, if you put them in a condition where they cannot grow, all right, and you even eat, you have digestive juices
That will
in your
deal with
stomach that
them.
will deal with them.
Right.
But because their numbers will not be so high.
Okay.
All right. But if you leave them to increase and then they produce these toxins and all that, that is where you end up having the food poisoning. It is always good, like he mentioned that he likes eating hot food. I would advise him to continue eating hot food.
99.7
Okay.
FM.
It's not so hot to burn your tongue.
Right.
All right, but it should be hot, piping hot,
Right.
so that you can eat. And because at those temperatures, like I mentioned, microorganisms cannot survive.
Right.
Okay, but you cannot say buy wache in the morning on your way to the office at a particular joint, and you say that this wache is so good. You don't have a fridge in the office. There's no microwave in the office. You keep the wache under ambient temperature from morning till about lunchtime,
Right.
and then you go to eat such wache.
Okay.
I tell you will fall ill.
Right. Okay. No matter how good it tastes, be mindful of the food safety.
And so don't allow your taste buds to
processes.
deceive you.
Kofi, we didn't get to talk about some of the packaged goods. We'll look at whether we can continue
Sure.
next week. But very quickly, expired goods and expiry dates. We could do that. We've got about 6 or 7 minutes. When we say expiry date, and we say also best before dates, tell us what it means and what we should be looking out for.
All right. I don't want to bother our listeners or our viewers with technicalities.
Okay.
Right? But these are dates of minimum durability.
Minimum.
Minimum durability.
Okay.
Of a product.
Right.
Okay. beyond which the manufacturer is saying that I cannot guarantee.
I can't vouch for it.
I can't vouch for the safety or
So
the quality of the product.
don't go there.
So don't use it.
All right.
So to speak.
All right.
What it means technically is that you can have a product beyond that date, okay, and it may still be safe.
Okay.
But remember also that it is also subject to handling.
Right.
Okay? So if I have a product in my house, okay, and then the expiry date is today, what will definitely happen to the product that if I use it tomorrow, I will die?
All right.
Nothing may happen.
Okay.
But even the product that I have that is expiring today, if I do not know how it was handled
Right.
in trade until I got it,
Okay.
by the time I'm even getting it, 3-4 months with expiry, it is not maybe the same product that the manufacturer would have wished I had.
So the system
So
and the processes.
The processes of handling the product in itself will impact on the safety of the product, quality of the product. And so it is always advisable to use the product within the period that has been assigned to it by the manufacturer.
Right.
And moreover, because it is a legal requirement, that is why the FDA or other agency will ensure that retailers do not display the product beyond these dates.
Okay.
All right? I admit, you go to certain jurisdictions, certain places, expired products are given out as food rations and all that. That is them. Because they have systems that will ensure that all these temperature conditions that we are talking about are maintained. The warehouses.
But for us, it is.
It is not. Virtually everything is sold on the sun.
I'm looking for you to emphatically say it is a crime. Is it?
It is.
It is a crime.
It is a crime. It is illegal. It is illegal.
And to display for sale
a product that has gone past its best before date.
Right. And if it hasn't been sold yet and you find it in my storeroom or in storage waiting to enter the supply chain, I'm still committing a crime.
Yes, you have not put it in. I will advise you at that point, arrange for its safe disposal. All right?
Right.
I will ask you to arrange, because once you've put it out there, granted you were supplying, you've not finished selling, and you have recalled them back into the warehouse. It's in a warehouse, but it should not be mixed with fresh ones that are supposed to go. If they are together with fresh ones that are supposed to go, then the likelihood that these expired ones will be sent back to the market is high.
Right.
That's why they should be separated and then
what is
be
the process?
prepared for.
Are they destroyed?
Yes, we supervise
disposed of.
We supervise the destruction.
Supervised by the FDA.
By the FDA. So we, together with the operators at the landfill site, and so you, the owner, will have to arrange for the vehicle. We take inventory of it. We arrange for a vehicle to transport it to the landfill site, and then it is disposed off at the landfill site.
Okay.
All right, so you have all these tractors
so the
running
FDA
after
has
them.
to supervise.
We have to supervise the destruction
of expired
goods,
food products or goods.
Yes.
Okay, and you do that.
We do that all the time.
All right.
We do that all
If
the
I
time.
find that I have unconsciously, unknowingly, ignorantly purchased a product that has expired, what am I required to do? Very quickly, Kofi.
Okay. As a good citizen, I will first and foremost advise you that bring it to the attention of the retailer that this is what I have.
Tell whoever is selling it.
Yes.
Right.
This is what I bought from you.
Okay.
Probably you may have some more that other innocent persons will buy. Take them off your shelf.
Right.
All right.
I have the right to do that.
You have the right to do that.
Okay.
And I expect the retailer to replace it.
All right.
All right. Situations arise where the retailer becomes very adamant and very argumentative. At times, they even want to be very controversial.
All right.
All right. Nothing stops you from reporting this, not only to the Food and Drugs Authority, even to the police, that this is what you have found in this particular shop.
Okay.
They are selling expired product.
Okay.
And there are some people who have made it their profession that they go to these big importers, and when the products are very close to expiry, buy it off them.
Right. They
And,
negotiate a good deal.
Yes, and I've always served this judicial notice to them because the FDA has its eyes on the ground.
Okay.
There's a place around behind Accra Breweries towards the railways. They call the place Donkomi.
Donkomi in Abuja.
Okay, and that is what they do.
Right.
And you go there, and they are fond of tampering with date markings on products, and especially with digital dates. All right, you know, I led a team some time back where we caught these guys. What they can do is that even